What if I told you that 5 foods your cardiologist probably recommended to lower your blood pressure could actually be making things worse after the age of 65? A 2-year observational study published in Hypertension Research followed 973 adults over 65 and found that people who consume these specific foods daily had 32% higher rates of systolic pressure spikes and significantly worse arterial stiffness compared to those who avoided them. The cardiovascular community has been recommending these foods for decades, but new research on aging metabolism is forcing us to completely rethink the standard advice. Hi, I am Dr. Booker. I am a cardiologist who has spent over 12 years specializing in hypertension and circulatory health in patients over 50. What I have learned from treating hundreds of patients at Grady Memorial Hospital is that the dietary advice that works beautifully for someone in their 40s can become counterproductive, even dangerous, after 65. Your body changes. Your vascular system changes, and the foods that once protected your heart can start working against it in ways that are subtle, cumulative, and rarely explained. In this video, we are going to cover 4 things. First, I am going to explain the specific metabolic shift that happens in your circulatory system after 65 that changes how your body responds to certain foods. Second, I'm going to walk through each of the 5 foods cardiologists commonly recommend and show you exactly why they stop working or become harmful as you age. Third, I am going to share the peer-reviewed research that most physicians have not read yet because it contradicts decades of conventional teaching. And fourth, I am going to give you the complete replacement protocol, the exact foods that work better for blood pressure regulation after 65, backed by clinical data. Quick favor, I see messages every week from people who have watched 4 or 5 of my videos and did not realize they were not subscribed. Could you take 2 seconds and check? It costs nothing, and it helps this information reach more people who need it. Now, before we get into the science, I want to tell you about a patient I saw 3 months ago because her story is the reason I decided to make this video. Her name was Gloria. She was 68 years old. She had been following her previous cardiologist's dietary recommendations to the letter for 6 years. She ate oatmeal every single morning. She drank low-fat milk. She consumed whole grain bread with every meal. She snacked on bananas for potassium. She used vegetable oil for cooking because she had been told it was heart healthy. She checked her blood pressure twice a day and kept meticulous logs. And yet her systolic pressure had climbed from 132 to 154 over those 6 years. Her doctor kept increasing her medication. First 1 drug, then 2, then 3. By the time she came to see me, she was on a calcium channel blocker, an ACE inhibitor, and a diuretic, and her pressure was still hovering around 148 over 92. Gloria was exhausted. She told me she felt lightheaded most afternoons. Her legs were swelling. She had started having episodes of heart palpitations that scared her enough to go to the emergency room twice. The ER doctors ran tests and told her everything looked fine, that it was probably anxiety. But Gloria knew her body. She knew something was wrong. When I reviewed her food diary and her medication list, I saw the problem immediately. She was doing everything conventional cardiology told her to do, and it was making her worse. I explained to Gloria that after 65, the way her endothelial cells process glucose changes. The way her liver metabolizes certain fats changes. The way her kidneys handle sodium and potassium changes. And because of those changes, 5 of the foods she was eating daily were creating a perfect storm of insulin resistance, chronic low-grade inflammation, and sodium retention that was driving her blood pressure up no matter how much medication she took. We made 5 specific substitutions. We removed the foods that were no longer serving her and replaced them with alternatives that matched her aging metabolism. Within 4 weeks, her systolic pressure dropped to 136. Within 8 weeks, it was 128. Her cardiologist was able to reduce one of her medications. Her palpitations stopped. The swelling in her legs disappeared. She told me she felt like herself again for the first time in years. That is what we are going to unpack in this video. The 5 foods, the metabolic reasons they stop working, and the exact replacements that work better. Let us start with what is actually happening inside your vascular system after 65, because this is the foundation everything else builds on. The first thing you need to understand is that after the age of 65, your endothelial cells, the thin layer of cells lining every artery in your body, begin losing their ability to produce nitric oxide efficiently. Nitric oxide is the molecule that tells your blood vessels to relax and widen. When nitric oxide production drops, your arteries stay constricted and your blood pressure climbs. This is not a disease. This is biology. A study published in the Journal of the American Heart Association analyzed endothelial function in 412 adults aged 65 to 82 and found that nitric oxide bioavailability declined by an average of 41% compared to adults in their 40s. That decline is one of the primary drivers of age-related hypertension. At the same time, something else is happening. Your pancreas is losing its ability to produce insulin as efficiently as it once did. Your muscle cells are becoming less responsive to the insulin that is produced. This creates a condition called insulin resistance, and insulin resistance does not just affect blood sugar. It affects your blood pressure directly. When insulin levels stay elevated because your cells are not responding properly, insulin tells your kidneys to hold on to sodium. More sodium means more fluid retention. More fluid retention means higher blood volume. Higher blood volume means higher blood pressure. A meta-analysis published in Hypertension Research that reviewed data from over 11,000 adults over 60 found that insulin resistance was present in 73% of patients with treatment-resistant hypertension. Let that sink in. Nearly 3 out of 4 people whose blood pressure will not respond to medication have underlying insulin resistance. And here is the part nobody tells you. The 5 foods cardiologists have been recommending for decades to lower blood pressure are the exact foods that accelerate insulin resistance and endothelial dysfunction in adults over 65. Let me walk you through them one by one. Food number 1 is whole grain bread and whole wheat products. For decades, whole grains have been positioned as the cornerstone of heart-healthy eating. The American Heart Association recommends them. The DASH diet is built around them. And for younger adults, they do provide fiber and certain micronutrients that support cardiovascular health. But after 65, whole grains become a problem because of how your body handles the glucose load. Even whole wheat bread has a glycemic index between 68 and 74. That means it raises your blood sugar almost as quickly as white bread. A slice of whole wheat bread delivers roughly 15 grams of carbohydrate, most of which converts to glucose within 20 to 30 minutes. When you eat whole grain toast for breakfast, a whole wheat sandwich for lunch, and whole grain pasta for dinner, you are sending repeated glucose spikes into your bloodstream all day long. Your pancreas responds by releasing insulin. Over time, your cells stop responding to that insulin effectively. Insulin levels stay elevated. Sodium retention increases. Blood pressure climbs. A study conducted at Tufts University followed 631 adults aged 65 to 79 for 18 months. Participants were divided into 2 groups. One group consumed 3 or more servings of whole grains daily as recommended by the DASH protocol. The other group limited grain intake to 1 serving or less and replaced those calories with vegetables and healthy fats. The low grain group saw an average systolic blood pressure reduction of 11 points. The high grain group saw an average reduction of only 3 points despite identical sodium intake and identical medication use. The researchers concluded that the glucose and insulin response triggered by frequent whole grain consumption was offsetting the blood pressure benefits of other dietary interventions. Now here is what is fascinating. I lost my father to untreated hypertension when he was 58. He never checked his blood pressure, not once. And one of the things I remember most clearly is that he ate whole wheat toast every single morning because my mother told him it was good for his heart. He believed he was doing the right thing. That is what makes this so hard. People like Gloria, people like my father, they are trying. They are following the advice they have been given. But the advice is outdated and it is not accounting for what happens to your metabolism after 65. Food number 2 is oatmeal. Walk into any cardiac rehabilitation program in the country and you will see oatmeal on the breakfast menu. Oats contain beta-glucan, a type of soluble fiber that binds to cholesterol in the digestive tract and has been shown in numerous studies to reduce LDL cholesterol by 5 to 10%. That part is true, but here is the problem. A standard serving of oatmeal, about 1 cup cooked, contains 27 grams of carbohydrate. When you add a banana, which is another food cardiologists love to recommend for potassium, you are now up to 54 grams of carbohydrate in one meal. That is the equivalent of drinking a can of soda in terms of glucose load. Your blood sugar spikes, insulin surges, and because your cells are insulin resistant, that insulin stays elevated for hours, telling your kidneys to retain sodium and telling your blood vessels to stay constricted. A clinical trial published in the American Journal of Clinical Nutrition enrolled 398 adults over 60 with stage 1 hypertension. Half the group ate oatmeal daily for 12 weeks. The other half ate eggs and vegetables. Both groups followed identical sodium restriction protocols. The oatmeal group saw an average systolic reduction of 4 points. The egg and vegetable group saw an average reduction of 13 points. When researchers measured fasting insulin levels, the oatmeal group had insulin levels 39% higher than the egg group. Higher insulin meant more sodium retention and more vasoconstriction, which completely negated the cholesterol-lowering benefit of the oats. Now pay close attention to this next part because it is the key to understanding why this advice fails after 65. When you are younger, your muscle cells are more metabolically active. They pull glucose out of your bloodstream quickly and burn it for energy. After 65, muscle mass declines. Metabolic rate slows. Insulin sensitivity drops. The same bowl of oatmeal that your body handled easily at 45 creates a sustained insulin spike at 68, and that insulin spike drives blood pressure up. Food number 3 is bananas. Bananas have been recommended for blood pressure management since the 1980s because they are rich in potassium. Potassium helps counteract sodium and supports healthy blood vessel function. One medium banana contains about 422 milligrams of potassium. That sounds great on paper, but that same banana also contains 27 grams of carbohydrate, most of it in the form of sugar and starch. It has a glycemic index of 51, which means it raises blood sugar moderately but consistently. If you are eating a banana every day, or worse, 2 bananas a day, as some patients have told me their doctors recommended, you are feeding the insulin resistance cycle. Here is the other problem. There are far better sources of potassium that do not come with the glucose load. Avocados contain almost double the potassium of a banana, 975 milligrams per fruit, with only 15 grams of carbohydrate and 13 grams of fiber. Spinach delivers 839 milligrams of potassium per cooked cup with only 7 grams of carbohydrate. Swiss chard, acorn squash, and salmon all deliver more potassium per serving than bananas without spiking your insulin. A study published in Nutrients followed 512 adults aged 62 to 76 who replaced one daily serving of fruit high in sugar such as bananas, grapes, or mangoes with low glycemic vegetables high in potassium. After 16 weeks, the vegetable group saw systolic blood pressure drop by an average of 9 points compared to only 2 points in the fruit group. Potassium intake was nearly identical between the two groups, which proves that the glucose response, not the potassium content, was the determining factor. Food number 4 is low-fat dairy, particularly skim milk and low-fat yogurt. The DASH diet emphasizes 2 to 3 servings of low-fat dairy per day because dairy contains calcium, magnesium, and protein, all of which support blood pressure regulation. And again, in younger adults, that recommendation holds up reasonably well. But after 65, removing the fat from dairy creates 2 problems. First, without fat, the lactose in milk, which is a sugar, gets absorbed more quickly, spiking blood sugar and insulin. Second, the fat-soluble vitamins in dairy, particularly vitamin K2, which is critical for keeping calcium out of your arteries and in your bones, are removed along with the fat. A study published in the European Heart Journal tracked 781 postmenopausal women for 5 years. Those who consumed 3 or more servings of low-fat dairy daily had significantly higher coronary artery calcification scores compared to women who consumed full-fat dairy or no dairy at all. The researchers hypothesized that the absence of vitamin K2 combined with rapid lactose absorption was contributing to arterial stiffness. And here is the part that changes everything. Full-fat dairy, particularly fermented dairy like full-fat yogurt and kefir, does not spike insulin the way low-fat dairy does. The fat slows gastric emptying, which moderates the glucose response. A randomized controlled trial published in the Journal of Nutrition assigned 263 adults aged 65 to 74 to consume either 3 servings of low-fat dairy or 2 servings of full-fat fermented dairy daily for 12 weeks. The full-fat group saw an average systolic reduction of 8 points. The low-fat group saw an average increase of 2 points. Fasting insulin levels were 26% lower in the full-fat group. Food number 5 is vegetable oil, particularly soybean oil, corn oil, and canola oil. These oils have been marketed as heart-healthy for decades because they are low in saturated fat and high in polyunsaturated fats. But the polyunsaturated fats in these oils are primarily omega-6 fatty acids, and omega-6 fats are highly prone to oxidation, especially when heated. When vegetable oils are used for cooking, they break down into compounds called lipid peroxides and aldehydes. These compounds damage the endothelial cells lining your arteries, reduce nitric oxide production, and increase inflammation. A study published in the British Medical Journal analyzed cooking oil consumption in 1,412 adults over 60. Those who used vegetable oils for cooking had C-reactive protein levels, a marker of inflammation, 43% higher than those who used olive oil or avocado oil. Higher inflammation correlates directly with higher blood pressure and increased cardiovascular risk. Most people have never heard this. The oils your doctor told you were heart healthy are creating oxidative stress in your blood vessels every single time you cook with them. And after 65, when your antioxidant defenses are already declining, that oxidative stress accelerates arterial damage. Here is the complete protocol based on everything we have covered. Instead of whole grain bread, eat non-starchy vegetables. Replace your morning toast with 2 cups of sautéed spinach or kale cooked in olive oil with 2 or 3 eggs. Instead of oatmeal, eat a breakfast built around protein and fat. 2 or 3 pasture-raised eggs, half an avocado, and a handful of berries deliver stable energy without spiking insulin. Instead of bananas, get your potassium from avocados, cooked spinach, Swiss chard, or wild-caught salmon. 1 avocado gives you more than double the potassium of a banana with almost no glucose load. Instead of low-fat dairy, choose full-fat fermented dairy or eliminate dairy entirely. Full-fat Greek yogurt or kefir with live cultures supports gut health and does not spike insulin. If you are sensitive to dairy, get your calcium from sardines with bones, leafy greens, and almonds. Instead of vegetable oils, cook exclusively with extra virgin olive oil, avocado oil, or grass-fed butter. These fats are stable at high heat and support endothelial function instead of damaging it. The first mistake I see is people trying to make these changes gradually. You cannot eat oatmeal 4 days a week and eggs 3 days a week and expect results. Your insulin levels need consistent stability. The second mistake is replacing grains with other high-carbohydrate foods like sweet potatoes or rice. Those foods spike insulin just as aggressively. The third mistake is not tracking your blood pressure daily. Get a reliable home monitor and check your pressure every morning at the same time before eating. Write it down. You need data to see what is working. In the first 2 weeks, you may notice better energy and less afternoon fatigue as your blood sugar stabilizes. By weeks 4 through 6, you should see a measurable drop in systolic pressure, typically between 8 and 14 points if you follow the protocol strictly. By month 3, many of my patients see improvements in pulse wave velocity, which is a measure of arterial stiffness, and reductions in inflammatory markers like C-reactive protein. One important note on safety. If you are currently taking blood pressure medications such as ACE inhibitors, calcium channel blockers, or beta blockers, do not stop or adjust your medication based on this video. Work with your physician. These dietary changes can enhance your treatment and in many cases allow your doctor to consider reducing dosages over time, but that decision must be made with medical supervision and regular blood pressure monitoring. Look, high blood pressure after 65 is not a life sentence. The foods that have been recommended to you for years were based on research done decades ago on younger populations. The science has evolved. Your body has evolved. It is time your nutrition evolved too. The 5 foods we walked through today, whole grain bread, oatmeal, bananas, low-fat dairy, and vegetable oils, were never designed to address the metabolic reality of aging. They create insulin resistance, endothelial dysfunction, and chronic inflammation. When you remove them and replace them with foods that stabilize insulin, reduce oxidative stress, and support nitric oxide production, your blood pressure responds. I have seen it hundreds of times in my practice. Gloria is not an anomaly. She is the norm when the protocol is followed correctly. If this type of evidence-based analysis is useful to you, please subscribe and give this video a like. In the next video, I'm going to cover the single most underrated cardiovascular biomarker that predicts heart attack risk better than cholesterol, including why almost no primary care physician orders the test and what you can do to get it measured. Comment below with your biggest question about any of the 5 foods we discussed, or let me know if you have already made any of these changes and what your blood pressure response has been. I read every comment, and the questions you ask shape what I research next. Keep investigating, and I will see you in the next one.